health sector, because the Ghana Registered Nurses and Midwives Association on June 13th suspended its nationwide strike after an intervention by the Parliamentary Select Committee on Health. The strike, which was to protest delays in implementing agreed conditions of service, significantly disrupted healthcare delivery across the country. Following the suspension, the association expressed hope that the parliamentary intervention would lead to swift and concrete actions from government agencies. The association issued a stern warning that the strike could resume if commitments made during the mediation are not fulfilled. Let's chat with our Labour Affairs correspondent, Danny Lopoku, who's been following the story closely. Danny, we understand that there was supposed to be a meeting between the association, the Parliamentary Select Committee, and the employers. What can you report from this meeting? Is it happening?
Right, so good afternoon to you, Kamene. Unfortunately, the meeting did not take place. Basically, the understanding we have is that some of the key stakeholders are not in the jurisdiction. The sector minister, we are told, has traveled, and other people or other members from the Parliamentary Select Committee are also not available. For that reason, the meeting could not be convened. And that really has sent some kind of anger to the leadership of the Ghana Registered Nurses and Midwives Association. And currently, they have decided that within a space of 1 month, they would expect that every agreement in the condition of service is implemented. Every content within the agreement is implemented. When they met the Parliamentary Select Committee 2 weeks ago, that's on the 12th and 13th of June, there were 4 major items that they agreed on. The first one has to do with book and research allowance. They also talked about 8% non-basic allowance, and then also fuel and uniform allowances. But unfortunately, the meeting could not take place, and really the people are much upset and expecting that the next meeting, that's 10th July, will be the next day for the meeting. That 10th July meeting should be able to resolve the problem, or there's a possibility that they could resume the strike.
That is to say that they are going back to work to continue what they have been doing.
Yes, rightly so. They are going back to work. Ever since they called out the strike, they have been working with a full gleam of hope that today's meeting probably would have been able to resolve a lot of the issues that they raised, because the commitment they had from the other key stakeholders, i.e. the Parliamentary Select Committee and also the Minister of Health, was that, and the Fairness and Salaries Commission, was that they have to meet today, get hold of the various issues, pick the issues item by item, if possible, roll out what we call payment schedule and see when those payments could be done. But unfortunately, the meeting did not take place. It has been shifted to 10th October, and they're expecting that 10th October should be able to resolve 4 major items. Beyond 10th October, the other items, possibly if the government is able to implement it by January 2026, that will be okay. But they would expect that by July close of July, then 24 items should be implemented.
Danny, I can imagine that they were very livid to think that they had to go all the way there to learn that the meeting will happen in the last minute. What did the leadership tell you? Right.
So yesterday they got a letter from the Parliamentary Select Committee that because some stakeholders are not within the jurisdiction, they may have to shift the meeting date to next week or to 2 weeks, and that's the 10th of July. And yesterday too was the day that they had their council meeting. Right? Interestingly, all the council members have moved from the regions and they are here, expecting that they would have been in the meeting today before the letter came in. They are not too happy. They are very sad with what has really happened, because their members nationwide are expectant. We are talking about an excess of 125,000 nurses and midwives. All of them are expecting to hear something positive from their leadership today, but because the meeting did not take place and it has been shifted to 10th July, they would have expected that government should be able to meet them and get the issues resolved. They believe that this is a spark of bad faith, because they would have expected a long a letter indicating the meeting will not. But for them to receive the letter yesterday, they believe that it was not too good for them. And for that reason, going forward, they would expect that some level of cordiality, some level of good faith should persist, should be present whenever they meet to discuss and their various issues.
Indeed, Danny, thank you so much for the reports. And Danny Lopoku is our Labour Affairs correspondent. We can take a listen to Perpetual Ofori Ampofo, who is the president of the Ghana Registered Nurses and Midwives Association.
Who are currently unavoidably outside the jurisdiction. Due to this development, the National Council of the Association at its meeting held on 25th June 2025, deliberated extensively on the content of the letter and wishes to state as follows. 1. The strike was suspended in good faith, and we expect nothing less than a reciprocity of same. The rescheduling of the meeting, in our view, is in bad faith, since it may further delay the implementation of the agreed items. We have, however, decided to give the committee the benefit of hindsight and still trust that their engagement with the Ministries of Health and Finance will be productive. Number 2, we demand the implementation of the 4 agreed items not later than July 2025. This is non-negotiable, and we shall advise ourselves if any attempt is made to further delay the implementation. 3, with the other items, we wish to reiterate our position that we are amenable to their implementation no later than January 2026. 4, we demand that these timelines are clearly captured and signed off at the 10th July 2025 meeting to avoid any ambiguity in the implementation schedule.